Hey, welcome back to Whiteboard Wednesday. It's Dr. Edwards at Sarasota Vascular. Today we're going to talk about the different types of vascular imaging. There's a lot of different ways we can image your blood vessels. Sometimes it depends on what we need to image and why, and of course the individual patient. But it can be a little bit confusing when we think about the different types of imaging. One type of imaging that we as vascular surgeons really depend on and have come to really use pretty heavily in our practice is ultrasound. So ultrasound is a non-invasive image. It can be done in the office setting. There's no radiation, there's no contrast, and what we're using is sound waves to make a picture. So those sound waves are generated by a probe. We place the probe sometimes on the leg, on the belly. Those sound waves generate a picture that allows us not only to see what the blood vessels look like, we can see if there's plaque inside, we can see if there's clot inside, we can see how blood is flowing in real time. So it really gives us good dynamic, sometimes what we call physiologic imaging, because we can understand how the blood vessels are working as we're looking at them. We can image almost all of the blood vessels in the body with ultrasound, except the blood vessels that are inside what I'll call a bony space. So like the blood vessels in the brain, we can do some ultrasounds to see inside the brain, but not really in great detail. Essentially throughout the belly, the legs, the arms, the neck, we can get really accurate pictures with ultrasound. So that might be what is recommended if you have leg swelling, if you have carotid artery stenosis, if you have peripheral artery disease. Usually ultrasound's where we would start. Now, if we see something concerning on ultrasound, we might need to get more detail that ultrasound sometimes just can't tell us. That might be where a CT scan or an MR scan comes into play. What you can think about here is it's like getting several x-rays done within a second, and then we stack all those x-rays together, and it's like a flip book. So we're going through the flip book, and we can take those images and run them through a computer and make 3D models where we can spin them around on the screen. CT imaging gives us really high resolution, very fine detail, and it's very helpful for planning surgeries, sometimes on the aorta, sometimes on the legs, on the carotid. It's helpful for understanding when the vascular anatomy starts to get really complex in particular disease states. CT imaging can be really helpful. The caveats to CT imaging are it does require radiation, and we are very well aware of the risks of radiation, and what we're really continuing to learn more and more is that there's a cumulative effect of radiation over a lifetime. So while we do need to use CT scans, we really don't want to get any more than we have to. MR imaging, MRI, sometimes MRA, which is an MR angiogram looking at blood vessels. This is a different type of imaging to view all different parts of the body that does not use radiation, uses a different type of contrast sometimes, but what MR uses is very, very strong magnets to actually realign certain particles within our bodies to help us generate images. Very, very good for looking at soft tissue. Very, very good for looking at ligaments and joints. It is good for looking at blood vessels, but we don't have the same MR technology available everywhere. So I wouldn't say that it's necessarily, the standard vascular imaging at every place. And then I want to mention angiograms. So angiograms is considered an invasive type of imaging because it involves us going through the blood vessels, placing little catheters in the blood vessels and injecting dye to take pictures. Sometimes that dye is iodine contrast. Sometimes that dye is just CO2 gas, which exists in our bodies. But by doing angiograms, we can essentially create a roadmap of all your vessels, find any problems that there may be, whether that's a stenosis or an aneurysm, and we can treat it at the same time. So that's the big advantage to angiograms, is it allows us to do the diagnosis and the treatment all at once. And angiograms, they can be done in the hospital, but also they can be done in the outpatient setting, even in the office setting, which is a huge, huge advantage for angiogram. And one other thing I just want to mention, sometimes we combine an angiogram and an ultrasound. We use an ultrasound to find the blood vessel, get access to the blood vessel, and then while we're taking pictures, we can put in special ultrasound called IVUS, intravascular ultrasound, inside the vessel to get a good 360-degree view of exactly what's going on inside. And that has become a really, really important part of how we treat a lot of vascular conditions. So in summary, if you're having vascular imaging, it might involve all of these in an effort to get the initial diagnosis and then using the angiogram to actually perform the surgery. Vascular surgery is exciting because we have all these different tools in our toolbox that we get to use every day. Thanks for tuning into Whiteboard Wednesday. It's Dr. Edwards.